Is it really important to have information in regard to dispensed medicines? Welcome back again to my YouTube channel where we focus on the basic medical information making a difference in our lives. Kindly, if you are new here, don't forget to subscribe. And if you are a returning subscriber, thank you for always coming back to watch my videos. My name is Rebecca Morangi and this is the best place to be. Today we are going to look at the importance of having the information in regard to dispensed medicines. In the present world, information is coming up about medicines which are already in use, and research is being done to bring about new information concerning the medicines which are already in use. Caregivers, prescribers, and the dispensers should be well informed about this information. Why? These are the people who are always in close contact with the patients who receive this medication. And which areas do we need this information? Or where are we supposed to give advice on? One area is on the choice of medicines. When you go to a health facility, different people come to get treatment. You have children, you have adults. For example, the adults, you have pregnant women. When we dispense medicines to pregnant women, most of the time we take note of, in pregnancy we have 3 trimesters. We have the first trimester, the second, and the third. Some drugs are contraindicated in the first trimester. So we should give advice to these pregnant women and even breastfeeding women. Another area we should give advice on is on the drug intervals. How often is a patient is supposed to take the medication? Is it after every 8 hours? Is it after every 12 hours? Because if you don't give this information correctly, they'll always do the wrong thing. Another area is about drug interactions. You have what we call drug-to-drug interactions. If you can remember, many times if you've ever gone to a health facility, you are given more than one medicine. And then you are told, take this one first, and then after 3 hours, you take this other one. The reason behind that could be what we call drug interaction. Another area is about the choice, the cost of drugs or medicines in the market. You have original medicines and then you have generics. Original medicines, most of the time the cost is high. Reason being, especially the cost of production. And generic medicines, they are cheaper. At least if not everybody, many people will be able to afford. So we should advise on, before you dispense medicine to someone, we always give them the cost. And this is the amount it will cost you this, or give a rough calculation if somebody is making an inquiry. Another area we should give advice on is on drug storage. Different drugs have got different ways to store them. There are those, especially medicines dispensed to young children, especially below 5. Most of the antibiotics, there are those which we need to reconstitute. And then after reconstituting, we are told keep them at room temperature. Others refrigerate between this and this level. So it's good to give advice on this area also. Another area is the duration. How long are you going to take the medication? Is it 1 month? Is it 7 days? Is it a day? So we should give the information so that, because if we do this well from the word go, we'll always get the positive results. Another area we should advise on is on drug, the side effects, what we call maybe adverse drug effects. I know each and every drug has got side effect, but some are mild. You cannot even realize, or the immune system or the body can be able to tackle that. But there are those which are adverse. We call them undesired. So we should prepare the caregiver or the patient about this information also. Tell them, if you see this is just a mild side effect. So, but if it's an adverse, you advise them to come back to the health facility so that they get to be advised accordingly. And then this information, how do we pass it on? There are those which we give verbally, and others we write. Especially on the verbal information, it should be well understood. If it means going an extra mile to explain in the language which the caregiver or the patient can understand, kindly, it's good to do that. Because remember, there are those who have never gone to school. They don't know how to write. So what happens? Whatever you tell them, that is what they will follow. So it's good to make sure they understand. And another thing, when you explain, make sure the caregiver or the patient takes attention. Because many times there is what we call interruptions. What we call should be face to face. Explain, and then at the end of it, you can even ask, have you understood? Or explain back to me, what have you understood? Another thing on the written, now for the verbal, make sure the patient or the caregiver understands, and then ensure they be attentive when you explain this information. On the written, this information should be clearly understood also. It should be clear. Sometimes if you have gone to a health facility and then you are given a prescription by a prescriber, many of the people say, how is this, the handwriting we can't understand. Yet it's true sometimes, but the professionals understand. That is where the dispensers, those who dispense medications, make it more simpler to the patient, even the caregiver, to understand. And then we should avoid writing the complicated medical terms. Kindly, if you are a healthcare provider here and you are watching this video, give a comment down below. Give us a term and try to explain, what does it mean? You have BID, you have TID, INOCTE. Kindly give us one term and give us the meaning. So we should give the meaning of these terms. You should make it more simpler to them. And then another thing we should take note of, let the patient, especially when you have given all this information, Let the patient ask questions. Ask them if they have something to inquire about. Also, this information, where are the sources of some of these informations? If you have ever dispensed medication, many times those who are in the field, we have books which has been written. Actually, that is tertiary, the third level of information. We have what we call the British National Formulary, the BNF. You have the drug index. Here we can get this information. Another area, most of the drugs have got inserts, isn't it? Yes. Those inserts, they have very good information also. So you can even tell the patient, if he wants to get more information, can read. Others, they're very smart. They even go home, they read something, and then they come back to get clarification. That is very important. Another thing, research. Some institutions have done research, especially the institutions which discover new medicines. And then they compile the information. We get information also from there. So we can get this information through research institutions. You can get through the books which has been written, and then the inserts which are contained in those drug packages. And then one thing we should take note of on the verbal communication, there are some around 10 things we should clearly emphasize on. Point number 1 is how much of the drug, or how often is the drug going to be taken, or the medication. Is it twice a day? That is after every 12 hours. I believe I said this earlier, but it's good to emphasize on. Twice a day, that is after every 12 hours. Is it after every 8 hours? Is it after every 6 hours? Give that information very clearly. Another thing, for how long? Is it for 1 month? Is it for 1 week? You should give that information. How long is the treatment going to take place, especially with antibiotics? Antibiotics, when they are being dispensed, you are told, make sure you complete the course. Why? Most of the antibiotics, if you take incomplete dose, they cause what we call drug resistance. That is a point. Going forward, we are going to have some study about drug resistance. So for antibiotics, we should advise the caregiver or the patient to complete the dose. Another thing, it's good to inform them not to share medications. Many times when you dispense medicines, they go home, you get, maybe there is a neighbor who has developed something, and then they try to share some information, and then one says, actually that is the same problem I have, so kindly can you give me 1 or 2 tablets? That is very wrong. Medically, that is very wrong. It's not good to share medication. It's good you walk to a health facility, explain to the prescribers or to the doctors, and then you are given your own prescription which will take care of your condition. Another thing, we should tell the patient to keep medications away from children. I believe everybody, if not all of us, many of us, we have gotten this case, especially when people come to a health facility, maybe carrying a child, then they say he or she has taken an overdose of paracetamol syrup. What are we supposed to do? So it's good to keep drugs safe and medicines safe, all away from young children. Another thing is to explain the storage conditions. I said it earlier. kindly you should get information on how you are going to store your medication. There are those which are supposed to be protected from light, direct light. So you should get that information well. And then another thing is to tell the caregiver or the patient not to stop the treatment, even if the side effects occur, unless they have contacted the prescriber. Because you can decide to stop the treatment when you see the side effects. You have not completed the dose, so what will happen to yourself? So it's good to always come back to the health facility, or go to the nearby health facility and then report that case. The prescribers and the dispensers will be able to take it up and then give the necessary advice. Another thing is to ask. After you have done all this, make sure you ask if there is a question or if there is somewhere they have not followed up, so that you clarify. If there isn't, give them a challenge to explain to you whether they have understood. Many times we get the reverse of what you have explained. I don't know, it could be the reason as some, they don't really concentrate. There are those even who go home and then they make a call to the health facility to ask, I did not get on how I'm supposed to take this medicine. So it's good to ask them to explain. It's very important. Remember, our channel, it's about giving the best medical information which can bring a difference in our lives. So if you get the information well in regard to dispensed medicines, and then you follow the rules, you'll be able to get the positive results. But if you don't, for example, on what we call drug interactions, let me emphasize this. There are some drugs, if you take them at the same time, especially a class of antibiotics, is it the tetracyclines? Yes, tetracyclines, and then you take them together with antacids. These drugs interact because the antacids has got, if it's magnesium or it's a calcium antacid, these ions form a compound. Actually, they coat this drug. You have taken them together. These calcium ions will coat this drug, what we call a gelatin effect. And then they will form a complex compound which will not dissolve. What does that one mean? The drug will be in the body, but it will not be available to exert the desired effect. So, drug interactions should be well explained. If you are told take this 1 hour before breakfast, kindly do that. There is a reason to why you are told that. Take this on a full stomach, there is a reason. But when you do the reverse of that, you will not get the correct results. We'll be taking the same drugs at the same time. At the end of the dose or the course, you will not receive the desired effect. You'll go back again. If the doctor or the prescriber will not be able to detect where the mistake was, we'll be rotating there. Have this condition, you're given the medication, you go, you do your whatever you do, so you not get then. So from the ground, we should get this information well and follow them. I know this, all these points, we know them. That is why on the introductory part of my videos, I talked about the best ways to learn the basics. These are the things we know. But if we don't follow them, follow the instructions well, it will not make a difference in your health. Your condition will always be there if you don't follow the doctor's instructions or the prescriber's instructions. So it's good to take instructions well, and then we'll be able to make a change in our health. We'll be able to get well. So kindly, if you are new here again, don't forget to subscribe and give the video a like. Leave a comment also. If this is the kind of content you would like us to be learning, give us a comment below. I'll be able to connect with you and then get to make necessary content. So thank you for always coming back to watch my videos. For the returning subscribers and for the new subscribers, kindly continue to come back each and every time to watch on my videos. Thank you very much. Let's meet in the next video. Bye bye.